divide the thigh to three compartments: anterior compartment, medial compartment, and posterior compartment. In anterior compartment, I'm able to show you the sartorius. Sartorius is one of the muscles. Sartorius is a oblique and very long muscle. And here also I am able to show you quadriceps muscle. Quadriceps muscle consists of four heads. This head we call the rectus femoris. Medially we call the vastus medialis. And laterally we call the vastus lateralis. So vastus lateralis, rectus femoris, vastus medialis, and deep to rectus femoris we are able to show you the vastus intermedius. So here is the vastus intermedius. Four heads belong to the quadriceps femoris. Now in the medial side, I can explain the adductor compartment. In adductor compartment, I am able to show you the gracilis. It is the superficial muscle. Adductor longus is visible, and here the adductor magnus. So adductor longus, adductor magnus, and the gracilis are visible. If you notice here, you can find an inverse triangle that we call the femoral triangle. In this femoral triangle, the laterally bonded by the sartorius, medially bonded by the adductor longus, and the base is superiorly and formed by the inguinal ligament. Inside of the femoral canal, from lateral to medial, we are able to show you the femoral nerve, femoral artery, femoral vein, and the femoral channel. You know the femoral nerve is not inside of the femoral sheath, but femoral sheath is going to cover laterally the artery, in the medial vein, and in the medial the femoral channel. Now some of the branches that belong to the femoral nerve are visible here. They are going to innervate the muscle, they are going to innervate the skin. One of the superficial, one of the cutaneous branch of the femoral nerve we call the saphenous nerve. Saphenous nerve is visible here. If you notice, the saphenous nerve is here, and if you notice, it is the saphenous nerve. Okay, saphenous nerve is going to pass through the adductor channel. You know the adductor channel is going to continue the apex of the femoral triangle. The adductor channel is here, and the inferior opening of adductor channel we call adductor hiatus. You know the femoral artery, the femoral vein are passing through the adductor channel, but the saphenous nerve never passes because very soon pierce the roof and come here. So the saphenous nerve is one of the branch, one of the sensitive branch, cutaneous branch that belong to the femoral. It is responsible to innervate the skin of the medial side of the leg, medial side of the foot. Okay? Now, the saphenous nerve is responsible to innervate the skin of medial side of the leg, medial side of the foot. Now, here in the femoral triangle, if you notice, one of the largest, one of the biggest and thickest branch we call the femoral profunda femoris. Here is the profunda femoris. Profunda femoris is visible. One of the branches that arise from the profunda femoris is lateral circumflex femoral, and one of them is medial circumflex femoral. To be able to show you the lateral circumflex femoral, you can here I am able to show you the lateral circumflex femoral. It is the lateral circumflex femoral. Okay? It is the circumflex, and here is the femoral, and here is the lateral circumflex femoral. Now, if I rotate and show you the posterior compartment of the leg, in the posterior compartment of the leg, I'm able to show you the hamstring. I'm able to show you the hamstring muscle. Do you remember the name of the hamstring muscle? Do you remember the name? No? Biceps femoris laterally, semitendinosus and semimembranosus medial. Why we call semitendinosus? Look at here.
Because it changed to a
the
tendon.
long tendon inferior. Why we call the semimembranosus? Because a long membranous part superiorly. It is semimembranosus, it is semitendinosus, and biceps femoris. Why we call biceps femoris? Because long head and short head.
Short head.
Long head and short head. Long head attached to ischial tuberosity, short head attached to the femur. And inferiorly, the tendon of biceps femoris is visible here. Now, about the gluteal region, please look at the gluteus maximus. If I remove the gluteus maximus, some of the medius and minimus is not visible clearly here, but for the deep layer of the muscle in gluteal region, I'm able to show you some of the muscle. Look at here. Here is the superior gemellus, obturator internus, and inferior gemellus. Superior gemellus, obturator internus, and inferior gemellus. This is the thickest nerve in our body. What's the name? Thoracic nerve. And this is the posterior cutaneous nerve of the thigh. As you know, the posterior cutaneous nerve of the thigh, the sciatic nerve, belong to the sacral plexus. The sciatic nerve is coming down, divided to two branches. One of the branch is thick, and medially we call the tibial, and one of them is thin, and laterally we call the common fibular. Common fibular or common pronal. In the posterior compartment of the leg, you are going to look at two gastric menus with two heads, medial head, lateral head. If I remove the gastric menus, the soleus is visible. Soleus and gastric menus, all of them are going to form for us the calcaneal tendon or Achilles tendon. It is the strongest tendon in our body. If I remove the soleus, I will be able to show you the tibial nerve, the posterior tibial artery. Here you are going to look at two tibial nerve, and this is the posterior tibial artery, and this is the pronal branch. Pronal branch and posterior tibial artery. Now about the line. About the line. As you know, during the childhood, the color of the line are pink, but with the time, when we are going to breathe and live in a large city center, the color is going to change. About each line, at the first we should distinguish it is left or right line. How many fissure? One fissure. Oblique fissure. So at the first, two lobes, superior lobe, inferior lobe. And here, in anterior border that it is sharp, I'm able in left line show you the cardiac notch. And here is the lingular lobe. So lingular cardiac notch, and here is the costal surface of the lung. As you know, the costal surface are going to be adjacent to the costa. So the ribs are going to affect. Okay? It is the...
This is left.
Yes. Costal surface, here is the apex, and here is the base or diaphragmatic surface. Mediastinal surface. In mediastinal surface, the hilum is visible. Anterior border is sharp, posterior border is rounded. So if we notice here in the left lung, here is the cardiac impression. Superior to the hilum, this rounded or curved groove belongs to the arc of the aorta. And here is the descending aorta.
Thoracic
and here
aorta.
is the esophagus. The diaphragmatic surface of the left line and diaphragmatic surface of the right line, please compare to each other. Which of them is more concave?
The right.
Right,
Because of the
their
liver.
liver. Here is the cardiac impression. Cardiac
Here's the
impression. Now, about the right line at the first, I'm going to show you two fissures. Oblique fissure, horizontal fissure. So three lobes, superior, middle, inferior. Look at to the inferior border. Inferior border is around the base. And look at the anterior border. Again, sharp, posterior border, rounded. In the medial surface or mediastinal surface, the hilum, superior to the hilum, rounded right to the esophagus, arc of the esophagus, posteriorly esophagus and esophagus. Here, vena cava inferior, small, short, and vertical groove. Here, a long vertical groove inferiorly has relation with the inferior vena cava, and superiorly has relation with the right brachiocephalic vein. Superior vena cava and right brachiocephalic. And here is the cardiac impression. What's the exterior layer? Pleura viscera. Pleura viscera. Now here, please, at the first, the sartorius is visible. You know the muscle. Please look at to the medial compartment. We cut the adductor longus. So for posterior adductor longus, I am able to show you adductor brevis. Adductor longus exactly immediately posterior adductor longus, the adductor brevis is visible. About the bone, the maxillary bone, the lacrimal bone are here, lacrimal bone, and about the maxillary bone in this view, I am able to show you the roof of the oral cavity. You know the roof of the oral cavity is the floor of the nasal cavity. Here, it is going to be formed by the maxilla and posteriorly by the palate. These are the posterior opening we call choana. We call choana. If you remember, I told you that the choana are going to connect the nasal cavity to the nasopharynx. Okay? And about the choana, you should know medially the posterior border of the femur. Laterally is the medial plate of the cricoid process. It is posterior border. And inferiorly, it is not anatomical position. It is inferiorly posterior border of horizontal plate of the palatine, and superiorly you are going to look at the ala of the vomer and the sphenoid bone. Here, if you look at to the choana, medially bonded by posterior border, posterior margin of the vomer, laterally by the medial plate of the cricoid process, and inferiorly by the posterior border of the horizontal plate, palatine, and the superiorly, these are the ala of the vomer and the sphenoid. About you, it is the choana, and if you imagine, here is the vomer. Vomer is medial bonded, laterally the medial plate of the cricoid, inferiorly the posterior border of the horizontal plate of palatine, and the superiorly the ala of the vomer and the sphenoid bone. What's the name of this foramen? You know. What's the name of these teeth? Incisive foramen. Exactly one foramen on the roof of the oral cavity and behind of the incisive teeth. Now here you are going to look at to the horizontal plate of the frontal. Here is the ethmoidal notch, cristagalli, cribriform plate, cristagalli, cribriform plate. Posterior to the ethmoid, here is the sphenoid. If you remember, the superior surface of the sphenoid body, here you can find a body. Inside of the body, we are able to find which gland? Hypophysis gland. Hypophysis gland is going to insert in this fossa. This fossa is superior surface of the body in the sphenoids. Okay? Now about the boulage of the larynx. If you notice, it is the hyoid bone, it is the thyroid cartilage. As you know, the thyroid cartilage anteriorly make the laryngeal prominence or Adam's apple. Here is the superior thyroid notch, and here you are going to look at the arc of the cricoid cartilage. What's the name of this ligament, this fibroelastic membrane? Cricothyroid membrane. Some of the muscles are visible, such as the cricothyroid muscle, such as the thyroid muscle. Here is the oblique line, okay? All of the muscles in larynx are going to innervate by the inferior recurrent laryngeal, except the cricothyroid. This is going to be innervated by which nerve? External branch of the superior laryngeal nerve. Okay? External branch. What's the name of this? Epiglottis. Now, posteriorly, I am able to show you the plate of the cricoid. Here, look at the trachea. The cartilage are not visible here. They are absent. The connective tissue with the smooth muscle are going to fill and complete posteriorly. These are the arytenoid cartilage, and at the apex of the arytenoid, I am able to show you cornicate. Some of the muscles, such as the posterior cricoarytenoid, such as the transverse arytenoid. And here, if you notice, this is the vocal cord, and here is the rima glottis. This muscle lateral to vocal cord we call vocalis muscle. Vocalis muscle are lateral to vocal cord. If you notice, come near to the molar. This